Control Agency, the Solicitor General, the government spokesperson, the Chief Medical Director, Edward Francis Moore Teaching Hospital, Chairman and members of the AKI Victims Association, the bereaved families, the representative of the WHO, the Permanent Secretary, Minister of Health, and other government officials here present, media personnel here present. I would like to take this opportunity to welcome you all to this gathering, whereby we would like to update the bereaved families and the whole nation on the acute kidney injury outbreak in the Gambia, and to provide the findings of the various investigations. I want to first and foremost extend the condolences of His Excellency, the President, Mr. Adama Barrow, and his entire government to the bereaved families whose children are no longer with us today. May Allah grant them Al-Jannatul Firdaus and give you the fortitude to bear the loss. Acute kidney injury is a sudden onset of deteriorating function of the kidneys, which manifests as oliguria, diminished urination, or anuria, that's absent urination, and other symptoms such as edema, confusion, nausea, vomiting, diarrhea, shortness of breath, coma, etc. This is because the kidneys are damaged and unable to maintain the internal milieu of the body, leading to accumulation of toxic products of metabolism, which becomes fatal in some cases. Acute kidney injury has many causes. Among these are Escherichia coli infection, severe dehydration, which might be as a result of diarrhea and vomiting, nephrotoxic drugs and substances, malaria, etc. Background on the outbreak. On the 26th of July 2022, the Ministry of Health was alerted on the increasing number of children presented at the Edward Francis Moore Teaching Hospital, and many of these children succumbing to their disease. The Epidemiology and Disease Control Unit of the Ministry was instructed to swing into action to get to the root of the problem. The World Health Organization, WHO, was contacted for support in handling the outbreak. An incident management system was set up to manage the situation. The incident management system, the incident management team, was co-chaired by the Ministry of Health and the WHO. The membership comprised of an experienced team from the Ministry of Health and its various units and directorates, Medicines Control Agency, that's MCA, representatives of the partner institutions like WHO, UNICEF, Center for Disease Control, CDC in Atlanta, Georgia, doctors from the Edward Francis Moore Teaching Hospital, etc. Extensive deliberations took place in the committee meetings, and the AKI response decisions came from this committee. Various WHO experts, including the Regional Emergency Director for Africa, the Incident Manager for Africa, came to the country and participated in the incident management deliberations. Since the phenomenon was unprecedented in this country, it was very difficult to ascertain at first what was causing the acute kidney injury, AKI. The committee suspected that the AKI could be caused by drug toxicity, since paracetamol toxicity was identified as a cause of AKI in some countries in the past. The World Health Organization country office helped to send patient samples and samples of drugs used by these patients to laboratories in Senegal, Ghana, France, and Switzerland. In the meantime, doctors noticed a convincing trend in the occurrence and worsening of the disease in some of the children on consuming certain drugs. The Ministry of Health decided to ban these drugs even before receiving the confirmation from the laboratory testing. This led to the press release instituting the ban on the consumption of paracetamol syrup in the country on the 7th September 2022. This was later followed by a ban on promethazine syrup on the 10th September 2022. The ministry imposed these bans despite criticisms and complaints from some people at that time that we were banning drugs without conclusive evidence. During this time, some patients continue to receive treatment at Edward Francis Small Teaching Hospital, while some families opted to travel to Senegal for further treatment. The government and partners put our efforts together to provide the needed materials, including hemodialysis equipment for the children and other drugs and medical items. This involved an enormous commitment from the health workers in the hospital in providing care for the patients and in the field carrying out surveillance activities. The laboratory analysis confirmed that toxic levels of ethylene glycol, EG, and diethylene glycol, DEG, were found in 4 syrups, namely promethazine oral solution, BP, Cofexmalin baby cough syrup, Macof baby cough syrup, and Maghrib cold syrup. DEG and EG are organic compounds that are found in certain products such as industrial solvents and antifreeze, and are used as raw materials in manufacturing polymers. Accidental or intentional ingestion of DEG and EG products has been known to cause poisoning. Illegal use of DEG to replace glycerin or propylene glycol as a solvent in medications have been reported in some countries in the past. All 4 of these products were manufactured by Maiden Pharmaceuticals in India and were imported to the Gambia by Atlantic Pharmaceuticals. Government immediately banned Atlantic Pharmaceuticals, who got their license withdrawn and their premises closed. This was followed by police investigation into their activities. The Medicines Control Agency sprang into action with a series of steps to remove the drugs from circulation. These steps included a ban on the sale and consumption of all Maiden pharmaceutical products in the Gambia. This was followed by a recall of these products from the drug outlets and households. The outbreak was controlled by November 2022 after the products were removed from circulation.